manufacturers of AZT have already brought the cost of it down by about 70 to 75% for the public sector. We believe, and we've told them, that we think they can do better than that.
HIV/AIDS activists like the Treatment Action Campaign say, although GlaxoWellcome has reduced the price of AZT, it will still make large profits on sales. However, drug companies like GlaxoWellcome are not solely to be blamed. Government should also be held accountable.
We haven't had a firm price from government as to what they say is affordable. We asked for this before the election. I think there was a meeting with the Treatment Action Campaign where they were told that they would be given a price in June, but of course with the change in minister and the change in approach, things have not happened. And so we're really a little bit in the dark. Nobody said, get it down to this price and we can do it. And I think that's one of the problems. We don't know what we're fighting against.
Currently, the AZT needed to bring down the rate of HIV transmission from mothers to babies costs 400 Rand. Although government says it cannot afford this price, researchers say caring for ill babies will be even more expensive.
Children get sicker quicker, they tend to develop more severe disease, and they tend to have more frequent admissions to hospital for severe illnesses. Many children have repeated admissions to hospital. I mean, we've had cases where children come back 5, 6, 7, 8, up to 10 times a year.
Children with HIV also take longer to get well again.
A child with pneumonia without HIV will spend about 5 days in hospital. A child who has pneumonia with HIV will spend 10 days in hospital. And if you just look at the basic cost, for example, of admission to a hospital like Somerset Hospital, just for occupying a bed, it works out to around about 400 to 500 Rand a day. So 10 days for HIV positive with pneumonia is about 5,000 Rand compared to 2,500 Rand for a non-HIV positive child. So we're really saving quite a lot of money. That's besides the savings on the treatment with the antibiotics and the other medications that are needed to treat the pneumonia.
Even those who do not need hospitalization need a lot of constant care, which comes at a price.
It costs Nazareth House 2,500 Rand a month to look after each child in our care. Just bearing in mind that we have to have 24-hour staff all the time. We get a government grant, which is a third of what it costs to look after a child, and the rest is fundraising. Our children only receive normal medications, antibiotics, vitamins. They don't have any fancy drugs at all. There isn't any money for that.
Studies like the Wilkinson study undertaken by the South African Medical Research Council and another done at the Baragwana have definitely shown that it would be cheaper to provide mothers with anti-HIV drugs like AZT to prevent their children from being infected than treating HIV-positive babies.
We believe very strongly that an AZT pregnancy program would be cost-effective and in fact cost-saving. In other words, what it would cost you to implement, you would save in the long run because you wouldn't have to treat infected children. And regardless of what you do for infected children, they are a drain on health systems.
But trying to justify intervention programs that will have long-term benefits could be tricky.
It's difficult sometimes to argue with government things that are cost-effective because they have to spend money up front now. And it's not that easy for politicians to be able to justify saving money later if they don't have it now.
However, for those working with ill HIV-positive children, the benefits are clear.
If the mothers when they were pregnant, received the drug to prevent a baby being born, then we wouldn't have to look after these children. They wouldn't suffer. So at Nazareth House, we see the end result, and if it can be stopped, it should be stopped.
Okay, ngizizwa ngijabulile ngoba bakwazi ukuthi banginikeze amaphilisi eZT, ngakwazi ukuthi umntwana amathole aphume right enganalo igciwane. Futhi ngiyathanda ukuthi bebaqhubekele phambili banike nabanye abantu abakhulelwe, kwazi abantwana babo ukuthi baphile.
A recent Ugandan study done with a drug called nevirapine showed that a single dose of this drug to mother and baby, costing only about 40 rand, can also reduce the percentage of infected babies being born to HIV-positive mothers from 30% to about 13%. A comparative trial involving nevirapine is currently being run in South Africa. Whether the government will implement an intervention program if this drug proves to be successful remains to be seen.
I think we're seeing a change in that. We're seeing the Treatment Action Campaign holding lie-ins in the gates of Baragwanath Hospital with lots of people there. We're seeing the pickets of the American Embassy about drug prices. I think I'm perceiving a groundswell of support that is really starting to mobilize the community, and that's how it should be.
As for Jane Payne, the case for providing medicine to prevent mother-to-child transmission is clear-cut.
There are lots of arguments about why they shouldn't give mothers the AZT and the various drugs. But I don't think we've got a moral right to make that judgment. If the drugs exist, we should stop a baby being born HIV infected. The cost of looking after a sick child are enormous. The hospital costs, the costs in a place like ours at Nazareth House. The money can be found, I'm sure, and it should be found.